Universal health coverage is rapidly emerging as an essential framework to promote healthy lives and well-being for all people. As countries define their UHC policies and programs, there is a unique opportunity to ensure that UHC efforts include sexual and reproductive health and rights interventions that are grounded in evidence and based on the principles of human rights, gender equality, and equity in access.
And when I was in high school, I got a scholarship from Form 2 to Form 4, but the balance for Form 1 was still there. So I had to come and work so that when the exam was coming out, I would get money and go and get my certificate. So my auntie had said that she's going to pick me up and take me to where I was supposed to work as a house girl. And on the way, the bus, we arrived in Nairobi a bit late. And because we were not having good communication, there were no phones like we have today. The communication was cut. And when I arrived in Nairobi, my auntie was not there. I got a person who said that I will take you to where your sisters are living and I know them. So because again he spoke my mother tongue, I easily followed. And when we go to his house, that is the time he said, because it is on a Friday, every girl goes out with their boyfriend, so you're going to spend time here, and then your sisters will come. I know your sisters they're going to come. I stayed in his house that night, and another guy came, and they gave me food and juice, and I slept, and waking up, I was raped.
When I talk to a lot of families, I think the biggest issue with sexual and reproductive health is the stigma. The stigma in society is one of the barriers to accessing care. And so a lot of my clients will come when they have experienced so much abuse or have very severe symptoms and are at their last resort.
My name is Modoni. That's the name most people know me by, Modoni Wanjao. I come from Nyeri County. I'm a gender and children rights activist, mostly, or defender, you may call it so. The society that we're living in tends to isolate these issues, that issues to do with rape and defilement, or rather gender-based violence, are not health issues per se, So you find, okay, like in Nyeri, let me talk of Nyeri. What we found in Nyeri is that access to healthcare for rape victims or for gender-based violence victims is free.
In the area of research, there's still a lot more research that needs to be done and to be tied into the trainings. What are the population needs and what are the various presenting issues? So we are lacking adequate data on what actual populations are affected. Are these girls or are they women? At what ages? And what kinds of sexual violence is being perpetrated. We also are lacking data on what kinds of issues people are facing. Is it rape? A lot of the hospitals now have records only about rape, but we don't have enough records on other forms of sexual violence, such as sexual assault or FGM or unwanted sexual harassment or advances. So we need to have more comprehensive data that informs policy so that we can map funding for these programs as well as other resources that we may need. In a nutshell, I would say that nobody deserves a low quality of life. A lot of times people cry, and when they cry just loud enough, somebody somewhere will listen.